Thank you, Mr. Chairman. I'm proud to see the committee marking up the Accelerating Kids Access to Care Act, which would streamline administrative processes for providers who need to enroll in another state's Medicaid program due to a lack of services provided in the patient's home state. I was also proud to have a fellow Iowan and constituent, Dr. Alex Basuk, testifying before the committee in February to support this legislation. As a physician who practiced in a river community, it was not unusual for us to have patients come to us from Illinois or Missouri to seek care in Iowa. There is currently no standardized federal pathway for this process, meaning that providers must enroll in a state's Medicaid program whenever they see a new patient from that state and must maintain regular paperwork to remain enrolled in each state's Medicaid program. When a child from a new state is visiting a doctor, as may be the case if a child from another state travels to Iowa for care, there are often delays in care as the providers sift through weeks of paperwork, risking the health of children with critical life-threatening conditions. One case that clearly speaks to the need for this bill involves an 11-year-old from another Midwest state who has a very rare and serious condition known as mid-aortic syndrome, in which the aorta narrows, leading to multiple serious complications that can result in death if untreated. In this case, a referral was made from another children's hospital to Boston Children's Hospital, which operates a leading program to address this condition, and a comprehensive care plan was assembled in April of 2022. In the case of the child's home states, all providers at Boston Children's needed to be enrolled in the home state's Medicaid program before the state would authorize this care. By July 2022, the enrollments were still pending, which led to a cancellation of care that had been scheduled for the following month, August of 2022. The home state did not complete its enrollment of the Boston Children's providers until November of 2022. In early 2023, Boston Children's assessed the child, and a comprehensive care plan that included additional providers given the child's specific condition was assembled. A request for authorization was submitted in May of 2023, and the care was ultimately provided in September of 2023, nearly a year and a half after the initial contact occurred. Again, I am proud to see this committee move this critical piece of legislation, and I encourage my colleagues to support it. With that, I yield back.